I'm not going to try to put this on you. It takes me like 15 minutes to put on a Converse in the morning. Okay, well hold on, before you do that, let's step for a minute. I'm going to do something. So, some of your critical pass-fails are for the wheelchair. I didn't post the final practical grading sheet yet because I'm just going over one or two things, but it will 100% be up before you guys come back. And that's what you're going to be working off of for the final practical. So with regards to the wheelchair, do you remember what is on there for like pass-fail?
Brakes.
Right? So we have to, again, we're not kicking. I don't care how tired you are, how many patients you've seen, you are not kicking, or kind of like just reaching to do this thing. Your body mechanics are still important. You're still lining yourself up. You're still going to lock. And then again, you come around, front of the back, lock. And you have to check, and recheck your brakes. There's no question about it because some of these wheelchairs are fine. Some of them have been through like 5 million students before you. So if you don't check your brakes, that's where we come into problem. And the other nice thing is that if you'll be in groups of 3 today, one person can actually stand behind to stabilize because sometimes even if it's locked, it will still go. The other piece of information is that we have to do what? Seatbelt. I promise you somebody's going to do this. So the more you practice, hopefully the better it's going to be. You need to get the order right because what happens is people put the patient in and then they get very concerned about all this other stuff. Once the patient is seated, once the cheeks hit the seat, you buckle, and right before they're about to leave the seat, you unbuckle. Somebody will do that. You will have the patient try to stand before you're actually unbuckled. So again, that's another one. And the other one is that we are removing the leg rest before we are putting the patients into a wheelchair. We are not going to do this thing, which I'm sure you've seen if you're in a facility. This one needs another screw. We're not doing this. Why? Trip forward. Right? No. And then we're also not doing this. You are going to, for your practical, starting today, remove the leg rest and put it way out of the way because right? If you happen to be treating a therapist and Giovanni's coming in after you, is he going to necessarily know that that's in the middle of the floor? So again, small things that seem simple. Thank you for the cinematographer. Small things that are going to really make a big difference. So not only for your grade, but just that you start practicing the right order of things because you see how easy it is to get either confused or mixed up or nervous or something. And then, you know, if you've done it enough times, hopefully it will make sense. All right, questions? Okay, so what we're going to do is we're actually going to have, oh, you can be the case that you read. That's cute. So you had the right transfer modification. Okay, so question for the room. Which side do I want him to lay on? For myself, if this is my practical.
Head over there.
So lay down for a minute.
Right side.
Lay down the way they want you to. Yeah. So this happens a lot on the practical, so I'm kind of glad I'm starting with this one. Why did we start this way for the TFA and not have the affected side closer to us? Why? He has a transfer modification. He can roll. The only thing that is that this is missing. There's no other precautions. The only precautions are for positioning and education.
You don't want to squeeze the.
Not squeeze. You don't want the shearing forces, right? So it's going to be a lot harder for me to hold him here. So I would actually rather have him in the other direction. It just happens so many times in the practical. I wanted to find out what the rationale was.
I think we were
Did I draw it wrong?
No, I think we thought the stitches you couldn't go over.
I don't know why
I remember there was a confusion about it when we were practicing. Not.
Nobody emailed
Right.
like nobody
I
told me
know.
about it. Why? How can I
think
know?
we just assumed that we should.
Never assume. There's a saying in my house: if you assume, you're only going to make an ASS out of you and me. That's what happens when you assume things. Okay, so never assume. Okay. Always ask, especially the person who potentially holds your grade. So if you're confused, you know, and if Carlos is leading in the wrong direction, I'll talk to him about it. But I would have you the other way because I don't want to reach over unnecessarily, unless this was really his strong side and I wanted him to use it more. Alright, so come on the other way. Alright, so I know this is a little confusing because I'm kind of demonstrating two things at the same time, but what you're going to practice now is called a stand pivot transfer. So what we're going to do first is, I'm just going to show it to you and then I'll explain the regular way. So because we have your transfer limitation here, for bed mobility we're okay, right? He can do whatever he wants. There's no precautions for that. So if you can go ahead and bend this knee up for me. And you're going to go ahead and reach over onto this side. And 1, 2, 3 and roll. Good, I'm going to help you down, push up. Very good. Now, when we're going to put the patient into the wheelchair, we are not leaving it too far or too close. It has to be at a 30-degree angle. It is kind of like a pizza slice situation when you're parallel parking, right? So on the count of 3, just gonna leave space here. You're gonna go, bring your nose over your toes. This leg is essentially, make this one non-weight bearing, right? Because you only have one leg.
Okay.
So on the count of 3, you're gonna go 1, 2, 3. Oh, you know what? I almost fell my practical. If you transfer the weaker side, you will fail your practical. You always transfer the stronger side and you're guarding the weaker side in the event that they lose their balance. Alright, so again, on the count of 3, 1, 2, 3, up. You're not bearing the weight, stand up, stand up, stand up, stand up, stand up. Good, and pivot, turn, turn. Good, now reach back for the chair. Slowly lower, and then you can come up to yourself. Second. You can put your foot down this way already. Hear the lock? Can you put this one down anymore? Okay, and then you would shut the seatbelt. In the event of the practical, you will do this after instructing them appropriately. We will then take them out of the door, into the door, and then either up or up and down the curb, and then you're going to put them back on the mat. Okay? Now, to transfer him back onto the mat, I'm going to change my position because I have to transfer to the stronger side. And in this case, where is my stronger side? This one, right? So again, if you transfer to the weaker side on the practical, it's an automatic fail. There is no wiggle room with that one. It cannot be. Are we okay on that? No, I'm just telling you because you can get the practical. Oh, I don't know. I didn't remember. You didn't say it. I said it. I said it like twice already. It tends to be easier to take the leg rest off and you can feel it up. Without the wheelchair locked because the locks of the brake bump into the wheelchair.
And that's okay, on our practical, we're like, I'm gonna take the things off and then I'm gonna put the brake.
Yeah, as long as you, again, as long as it's locked before he transfers, that's all that matters. Alright, so let's come back here. Alright, so now what we're going to do is, oh, this is the other thing I have to correct. If you could unbuckle for a second, everyone can see kind of. There was one thing in the slides from Monday that I didn't correctly inform you. The forward hip slide push is actually when he pushes with his back. So if you push back and you slide your hip forward, nope, push here and then push your hips forward. Yeah, that's a forward hip slide. Okay, and so what we're going to do is we're going to do that one more time. So again, do your forward hip slide all the way back. You're going to slide, no, I can't tell, it's this slide too far. Just a little bit to the edge of the chair. Good, stop. Okay. And now you're going to bring your nose over your toes, push forward. And again, we're going to stand up on the count of 3 and we're going to go to the mat. So 1, 2, 3, stand up. Non-weight bearing, good. Turn, 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 and then reach back. Lower. Now I'm gonna never turning completely away from the patient. I'm just gonna do this, push that away, and then you can get yourself back up because you are actually, yep, completely independent. Questions? So this is, again, I did simultaneously two things. Thank you, Kenneth, for being the patient. I'm gonna go over sample transfer.
So same thing for a THA because he bent like here.
You can.
Can?
It's gonna be different.
Cannot.
So we'll talk about that in a minute. What was your question?
So, to confirm, we can roll amputation on. Okay.
You can roll, but what I was trying to avoid, where confusion probably was, is that if this is my amputated leg, you were probably trying to avoid this, right? If this was my stump, you didn't want to do this. But if you're there helping them, it's okay for them to do this, and then you can help them here.
Same thing if they're weak.
Yeah. But you always want to be, it's easier to be closer to the leg so that you can help it. It's awkward when you're reaching over the other side. If you don't have a choice, you don't have a choice. But in our ideal practical bubble setting where we're trying to make sure that you're doing all of your critical planning that we're talking about, it's nice to at least give yourself the advantage when you can. Because again, this is way more space you're gonna have in a hospital room or facility. It's like bed, chair, no, space, like 2 squares of space, sheet, and then other bed. So it's really important that, you know, you practice both, but at least you understand which one you want to be closer to when you can. So I kind of dove in with taking away the person's, gave them the diagnosis right away, but what we're doing today is called a stand pivot transfer. So actually, you're going to have to figure out where you're supposed to stand, because ultimately in a stand pivot transfer, if they have the ability to, it's exactly what it says it is, right? A stand pivot transfer means you have to stand, pivot, and transfer. Same thing. We do a push up here, stand all the way up, pivot, and transfer. This is not going to be the same as what we're going to do after for a more dependent patient. In order to do a stand pivot transfer, the patient has to stand. They must be able to possess the strength to stand. Whether it is on both legs or on the one leg, this is still categorized as a stand pivot transfer. So even if it's non-weight bearing, if this leg has the strength to do so, okay, so it's really important that you're doing all the things we talked about with getting the base support, nose over the toes, but this is where we're starting. So in order to do this, this is a stand pivot transfer. You need to figure out where you're going to be for the patient. I think I mixed up with Kenneth because I was on the affected side, but I was out of the way. Usually you're just in front of the patient, so you can move them. So you would just sit down for a second. If we're doing it to the stronger side, the problem is that you also have to stand out of the way in order to let them grab whatever they're going to grab. So if he was to do this independently, I've just told him, okay, Hannah, what you're going to do is you're going to come forward, bring your nose over your toes, push up from the mat. Yep. But you don't always want to grab the chair. That's why you want them to have, the reason that we don't reach for the chair right away in a stand pivot transfer is because they have to stand first. What we're doing is more of what we call a squat pivot, which we're going to do with here.
And then reach.
Because the other part of it is if you're trying to stand, come back for a second. If you're trying to stand and the chair does this,
What if it's locked? It's like staying.
does not mean anything. Could be locked in my head. If you're standing over here and if you're telling the patient what to do for a stand pivot transfer, then chances are A, they don't need you. But either way, you still want them to at least get their balance in order to stand, because the squat pivot is something different. So I don't want you guys to get that one mixed up. But in the event that he has a device, right? If he has a walker, if he has a cane, he's going to need to reach forward for that if he's moderate assistance, and then hold on to whatever the imaginary thing is, right? And then turn, turn, turn. And then you're going to come back and reach for it. Okay? All right. So what I want you to do right now is I just want you to practice number 1.